This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
You don't need to be a doctor to know that you see with your eyes, but did you know what a doctor sees in your eyes could give an early warning for a chronic disease?
Yeah, a chronic disease that, if caught early, can be managed. We're talking about diabetes, and at Chesapeake Eye Center, it's something the doctors there keep a very close eye on.
There's lots to see inside someone's eyes. Dr. Jason Yonker of Chesapeake Eye Center in Berlin is looking for signs of diabetes.
The eye is the only part of the body we can actually look inside of and see your blood vessels. In diabetes, that's what it does. It damages blood vessels.
It's that damage that Dr. Yonker says could reveal the early stages of diabetes.
What diabetes does is it causes inflammation and damage to the inside lining of the blood vessel. So you've got the blood vessel inside walls called the endothelium, so that gets damaged, and then the blood doesn't flow correctly.
Lack of blood flow causes lack of oxygen to the eye. Dr. Yonker says this could cause anything from microaneurysms to blockages, even the growth of new blood vessels.
And when that starts to occur, those blood vessels are leaky, they're leaking fluid, which is called edema or swelling, and then the new blood vessels can cause scar tissue to form, and that can lead to torn retinas and detached retinas and a whole host of bad things.
He says all of that can be avoided if, at the first sign of trouble in the eyes, the patient takes the necessary steps to control their blood sugar levels.
Have a talk with them about, making sure their blood pressures are controlled, how important it is to take their medicines, how important it is to comply with all the dietary, restrictions that have been put forward.
Dr. Yonker can also provide an injection in the eye that essentially calms down the blood vessels and prevents the growth of new vessels.
Which is one of the revolutionary treatments in eye care is these VEGF injections, and we give those to patients for macular degeneration and also for diabetic disease.
Another treatment uses a laser to seal the blood vessels shut, but it has to be done early before fluid gets into the macula and causes damage. Otherwise, the vision could be lost for good.
It's all about early detection, early prevention. So if you catch the little blood vessels while they're leaking, you can laser them shut. You can have an injection into the eye to calm it down, and that's a decision kind of based on the way the diabetes looks in the eye.
This vision into your vision center is done during a regular eye exam.
So anytime you get a dilated eye exam, which is where the doctor puts the drops in your eyes and opens your pupil and makes it really, really blurry, that's how we can look into the back of the eye. We're looking at your arteries, we're looking at your veins, we're looking at your optic nerve. And that's kind of just part of the comprehensive eye exam. Dr.
Yonker says sometimes the eye exam is the only way to see the earliest signs of high blood pressure or diabetes.
Us ophthalmologists, we're medical doctors. We went to medical school. We've done internships in taking care of diabetic patients as the primary care doctor for a year in our training, and then we transitioned into the surgery side of taking care of the eye. So we're kind of putting all this together and working in conjunction with your primary care doctor and potentially, an endocrinologist or that might be working with you as well.
It's a collaboration that could put into focus any problems that, if left untreated, could rob you of your sight.
And Dr. Yonker says he is seeing fewer serious eye problems caused by diabetes. He credits education, early screenings, and newer diabetes medication.
Get your screening.
Yes.
Get your screening.